Hello everyone, welcome back to my YouTube channel. I am Dhara, a CPC certified medical coder. In today's video, we are going to learn about ICD-10-CM, its structure and its conventions. Conventions are the fundamental rules used by medical coder to assign accurate diagnosis codes. Let's start by understanding what is ICD-10-CM. ICD-10-CM stands for International Classification of Diseases 10th Revision Clinical Modification. ICD-10-CM codes are used to classify diseases like hypertension, diabetes, injuries like fracture, abrasion, symptoms like cold, cough, fever, and healthcare encounters. ICD-10-CM was published by WHO, World Health Organization. Let's understand what conventions are. Conventions appears as notes and instructions throughout the alphabetic index and tabular list. ICD-10-CM consists of two main parts. First is alphabetic index, second is tabular list. Alphabetic index used to locate codes alphabetically. It contains of diseases and injuries, external causes, neoplasm table, drugs, and chemical table. The second part is the tabular list. The tabular list contains the complete code structure organized by chapters according to body systems, conditions, and diseases. It provides detailed coding instructions, code descriptions, exclusions, inclusions, and other important guidelines. For example, first and second chapters are about certain infectious and parasitic diseases. You can find all the diagnosis codes for bacterial diseases, infectious disease, coding instructions, and guidelines to assign these codes. Guidelines tell us to first locate the term in alphabetic index, then verify the complete code using tabular list. This is because the alphabetic index may not provide the full code. Details such as literality, code specificity, and any require of 7th character can only be confirmed in the tabular list. Let's understand ICD-10-CM code structure. An ICD-10-CM code can have up to 7 characters. Each character gives specific information about the diagnosis. First character represents chapter, second represents category, third represents subcategory, fourth represents etiology or type of condition, fifth represents site or location, sixth represents severity or specific details, and seventh represents extension, which tells us the stage of care. Let's look at an example. Let's take a same example from previous slide. S52.521A. Here A represents initial encounter, meaning a patient is receiving active treatment for an injury. D represents subsequent encounter, meaning a patient is coming back for follow-up care. S represents sequela, means a late effect or complication from an old injury. What is sequela? Imagine a patient had a fracture and it healed completely. But after a few months or even years, they develop pain or any other complication related to that old fracture. This is called an sequela effect or late effect. Next is placeholder character X. X is a placeholder or dummy character used when a code doesn't have enough characters. Also, the X is used as a placeholder at certain codes to allow for future expansion. Take these codes as an example. T36.0x1A. Here the X is a placeholder. In this code, there is no value for the fifth character, so we have used X to fill that empty space. Why? Because it keeps the 7th character A in the correct position. As you know that A, D, and S are the 7th characters. Remember, X doesn't have its own meaning. It's simply used so that the code follows the correct ICD-10-CM format. Next is NEC and NOS. These two terms are very common in medical coding. Let's understand first NEC. NEC is not elsewhere classifiable, means the doctor has given a specific diagnosis, but there is no exact ICD-10-CM code for this. For example, a patient has a very rare type of vitamin B12 deficiency anemia caused by a genetic disorder. But there is not specific code for ICD-10-CM. So the coder uses the other specified code for this. D51.8, other specified vitamin B12 deficiency anemia. In simpler words, we can say that the doctor knows exactly what the diagnosis is, but ICD-10-CM doesn't have a specific code for this. Second is NOS, not otherwise specified. NOS means the doctor didn't provide enough details about the diagnosis. For example, the doctor only documents vitamin B12 deficiency anemia but doesn't mention the type or any further detail. In this case, the coder used unspecified code D51.9, vitamin B12 deficiency anemia unspecified. In more simple words, we can say that NOS is the code exists but the doctor didn't give enough information about the diagnosis. Next is code first or use additional code. Some medical conditions need two diagnosis code. One code identifies the underlying disease and the other code identifies the specific manifestation or complication code caused by that disease. For example, if provider documents that patient has type 2 diabetes mellitus with other diabetic ophthalmic complication. Now the guideline is saying that code underlying disease first and code manifestation or complication second. What should be the first diagnosis in this case? E11.39 should be the primary diagnosis. This code tells us the patient has type 2 diabetes and that the diabetes has caused an eye-related complication. And here the complication is glaucoma, which is our manifestation or complication code. So the glaucoma is our secondary diagnosis code. Why is this important? Because using both diagnosis codes provide a complete clinical picture. Here you can see the use additional note beneath the code E11.39, which is saying that along with E11.39, use additional code for diabetic glaucoma. Also, there is one note for code first beneath the glaucoma code, which is saying that code first diabetes mellitus, then code for glaucoma. Let's understand exclude 1 and exclude 2. Exclude 1 means not coded here. It is saying that two conditions cannot normally be coded together. For example, congenital condition and acquired condition for the same disease. Congenital condition means born with that condition and acquired conditions means the condition develops later in the life. For example, congenital diabetes and acquired diabetes mellitus. You will also find exclude 1 note beneath the E10 code. A patient can't have both conditions at a time. Now, what is exclude 2? Exclude 2 means both conditions may exist together. For example, patient has type 2 diabetes and also has hypertension. We can code type 2 diabetes and hypertension together. So that's a basic overview of ICD-10-CM coding conventions with practical example. Remember, these conventions are not just theory. These are the rules that guide you to assign appropriate and accurate diagnosis codes and avoid coding errors. I hope this video will help you to understand these concepts. If you are serious about medical coding, make sure to subscribe and follow the series. Thank you for watching the video.